All right, good day, everyone. Thank you so much for coming out today to participate in our webinar, which is a very important topic, what to expect when delivering during COVID-19. My name is Sue Ellen Anderson Haynes, and I'm a registered dietitian nutritionist and founder of 360 Girls and Women. So our topic today is going to be delivered by Dr. Tiffany Martinez. And for those of you who don't know about her, she's going to tell you a little bit more about herself. But for now, I'm going to just introduce to you what 360 Girls and Women is all about for the new people that we have on the call. So 360 Girls and Women is a holistic wellness company for girls and women. We help to maximize a girl and woman's complete wellness through the complete life cycle. So what does that mean? We address wellness through all ages, which brings us to the complete life cycle. We also provide evidence-based health and wellness information, which is what we're going to be doing today. We also have educational classes and groups and wellness services that could be either one-on-one session or packages that you can purchase that are investment packages for your self and your family. We are plant-based lifestyles, so anything that is natural and organic, we endorse those things. Non-toxic personal care and home care is a theme that we carry out throughout our company. If you want more information, please feel free to send your questions or concerns to complete@360girlsandwomen.com. And for those of you who want more assistance in terms of nutrition, health, and wellness services, you can book a free 20-minute call on our website at 360girlsandwomen.com. You're gonna also have information that will be shared with you from Dr. Martinez, so you could address and contact her directly if needed. So next, I want to share with you our disclaimer. Today's presentation is for informational purposes only, so no diagnosis or treatment will be given. Personalization is only given when we are at one-on-one consultations, and that's something that you will book with one of us. So by participating in this presentation, you accept our terms and our conditions. This presentation will be recorded and posted. Oop, what happened? Let me go back one slide. And posted on our YouTube channel for those of you who want to view it or to share with your family and friends. So now I'm going to turn the floor over to Dr. Tiffany Martinez.
Thank you, Sue Ellen. So let me
just stop share.
Okay, perfect. Great. Great, perfect. All right, hi everyone. Thank you so much for joining us. Today, as Sue Ellen said, we are going to be talking about what to expect when delivering during COVID. Okay. So let me change a few things around here so I can see. Perfect. Sorry, just setting up my screen. Okay, so I am Dr. Tiffany Martinez. I am a board certified OBGYN. I previously worked in private practice in both Monmouth and Middlesex counties in the state of New Jersey. Currently, I'm an OBGYN hospitalist. A hospitalist, in my case, I am employed by the hospital and healthcare system that I work for, and I serve as what we call a safety officer, which means, let's say one of you who are on the call, you have a private physician and you're in the hospital for any reason, and your doctor wants a second opinion or a second set of hands or needs assistance in anything. The hospitalist or that safety officer is there to serve in that purpose. I also am in charge of patients who go to the hospital-owned private practice as well as our clinic. I also serve as director of our labor and delivery unit. With that being said, the thoughts and statements that you will see and hear today will be that of my own and do not represent the hospital or healthcare system that I work for. So delivering during COVID. So I want to go through quite a few topics. This is going to be super informal. I really want to have a great conversation with you guys. And I'm not going to bore you or bog you down with numbers and statistics. Sometimes that can translate into boredom and fear and anxiety. What I'm going to do is translate what we currently know about COVID and the obstetric patient and give you some real practical advice that will encourage you to take charge of your health and be a more informed patient and be an equal partner in what is taking place during this obstetric time in your life, or for your friends to share this information as well. So I'm going to answer the following questions. Who will be with me in labor? What should I pack? How will I enter the hospital? How will my stay be different? When will I be discharged? What questions should I ask? And the dreaded, what if I have COVID-19? And then I have some bonus information for you at the end. So let's talk about the visitor policy during COVID. So what you have to understand is this is a very unique time. Very few people are in today's pandemic that have also been in the last pandemic as a provider, whether it was H1N1, whether it was Ebola. There are pandemics that occur that we are not even affected by, depending on where you live in the world and the country. And so this is a rare time. This is not something that's common. And so things are constantly changing as we develop new information. But what you may not know is that each state may have its own policy. As you can see, I'm currently in the state of New Jersey. COVID hit us. Our numbers got really high back in March. So 4 months later, when you look at a map of the country and what's going on, you can clearly see that this is not something that swept across the country as a one-time thing, hit everyone hard. There are states that have and never will be affected as highly as us here in New York and New Jersey. And there are states who are just now reaching that same level and exceeding it. Your hospital may have its own visitor policy as well. You can go to their website and you can read about that policy specifically. But what you also have to know is that separate from the hospital, the actual unit that you may be on can have its own policy. So I'll give you an example. When COVID started to hit, a lot of hospitals put a restriction on that if a patient is coming in, they are not allowed to have visitors. However, there were certain rules or exceptions to that depending on the unit they were visiting. So if they were going to have a procedure, they were allowed to have a visitor. If they were going to have a baby, they were allowed to have a visitor under certain restrictions. So you may be approached or presented with policies on multiple different levels, and it's important for you to understand that and to gain as much knowledge as you can ahead of time. So who will be with me in labor? The end all answer is that I can't tell you specifically. And maybe what you can actually do, if you're online, you can kind of put in the chat box, where are you logging in from, what state or city that you're in, so I can give you the anecdotal experience from what I do know. But the person that will be with you, or if you will be allowed a person, I can tell you, being in the epicenter, there was a very brief period where obstetric patients were not allowed to have any visitors at all. That lasted for a very short and brief time. That probably had to be the scariest thing you could say to a patient and the scariest thing that a patient could hear who was going into labor. Since then, an executive order from the governor of New Jersey, as well as New York, has clearly stated that under no circumstance will an obstetric patient be forced to deliver on her own. So what do you want to do to know this information? Call and speak to your provider. Always start with them. So that's your doctor, that's your midwife. Ask them about the visitor policy in the hospital for which you will deliver. I'll even give you a hint. We're not really talking too much about the prenatal care aspect or the preventative care. We're really sticking to the inpatient hospital setting. But who comes to you who comes with you to your prenatal visit may actually be limited or changed based on COVID and where you are located. So ask about who can come with you to the visits, ask about who can come with you to the hospital, and then you want to cross-reference that with the labor and delivery unit itself. What the provider may tell you on Monday may change on Tuesday, and the people who will know will be the people that will be receiving you in labor. So you can call labor and delivery. You can ask to speak to a nurse manager or a patient liaison. Sometimes even the unit representative who answers the phone can answer that question for you. If you're not getting through with the phone calls, perhaps you're at a very busy hospital and you're not getting through there might be a hotline. If you go to the website of the hospital, there might be a frequently asked questions link. And these are things that are going to be posted very clearly on your website, or you simply call and get your questions answered. So I'm going to labor and delivery. What should I pack? Okay.
Excuse me one second. Can you guys see
Yeah.
the screen?
Yes.
Okay, for some reason I can't see my screen. Okay, go ahead.
Did yours just stop, Sue Ellen?
I mean, I'm on, but I can't see your presentation.
Okay. Can you see me?
I can't see anything, but I'll try to figure it out. Keep going because it's recording.
Okay.
Okay.
Right. So what are you going to bring to the hospital? So most of the things are going to be the same as if you were going into labor and delivering last year when pre-COVID. You're going to bring your toiletries, any makeup items that you want to have with you, any hair accessories, an outfit for mom to go home. And the reason why you only really need something to go home with is because while you're in labor, while you're in the hospital, you are going to, 1, be laboring, 2, be examined on multiple occasions. And so clothes are almost an unnecessary thing. We're going to provide you with a gown. We're going to provide you with multiple gowns, blankets to cover up. But actual clothes you might think you're more comfortable in them, but they will actually become a hindrance to your care. An outfit for the baby to go home. So while you're in the hospital, your baby will be provided with onesies, diapers, blankets, a hat, all of the necessary things. But you will need an outfit for that baby to go home in. And just a reminder, a lot of times we think about when we have our first baby, we're going into the hospital and we're either deciding whether we're going to get those pictures taken or not, right? They're very fancy, but also very expensive. Depending on the COVID numbers in your state, that service may be gone because it is one way to increase the spread of COVID by having this ancillary additional service that's there. So you can ask about that as well when you call your unit for further information. One of the most important things you want to bring is your identification or your driver's license. This can be oftentimes forgotten in a rush. And so you want to try and prepare ahead of time. Where am I going to keep my license? How am I going to remember to bring my wallet? Whatever it may be. Your identification is extremely important to the next line, which is registration and paperwork. Oftentimes, when you are a patient in a private office, they're going to ask you to register for the hospital, whether it's online or filling something out and mailing it in. That is crucial to the fluidity of your care. We cannot treat a patient until your name has been entered in the system, which can happen quickly or not so quickly depending on what's going on. But I just want to stress the importance of registering before you get to the hospital. Paperwork may include any consents that your providers may ask you to sign ahead of time. These are things that are going to make everything go much smoother. So I encourage you to bring all of those things with you. They should be already in your bag ahead of time. Slippers or flip-flops, I think those are super comfortable and easy to use when you want to get out of the bed and go into the shower. The hospital usually provides you with socks, but you may not want to stay in the socks. Just imagine, right? I'm just thinking about because the experience having a baby going into the bathroom, slippers are always a good thing to bring. You want to come into the hospital with a mask. Most people now have their own mask, whether they purchased it, whether they made it. You want to come into the hospital with a mask. If you do not have one, that is totally fine. Let them know. They will provide you. It is a state mandate to provide you with a mask. But if you have one, please do come in with one. A breast pump is an option. A lot of times, if you are not a first-time mom and you plan on pumping or breastfeeding, you have that whole concept down really well. And so you know, I want to start pumping from the time I'm in the hospital. Feel free to bring that in. A lot of hospitals will provide you with a breast pump as well. So that is an option. But if you have no intention on pumping during your stay, then you do not need to bring it. The next most important item to bring when you go to the hospital is your cell phone and your charger, because the visitor policy may be altered. Meaning, last year, if you were having a baby, you might have your significant other and their mom. You might have your sister and your cousin. At some point, 10 people might be in the room during this whole experience. That will most likely not be the case depending on what state you're in. So in the state of New Jersey, you are only allowed to have one visitor and one visitor only. And actually that visitor cannot be swapped out for another. And so you want to be able to contact those support people that you typically would have been able to talk to laugh with after the delivery. And so that charger is essential. I can tell you a quick story. I have a son, he'll be 3 next month. And when I remember when I went into labor, I wasn't sure what was happening. Call me crazy, didn't know what was happening. And so, contracting for hours in the wee hours in the morning, and then boom, full-blown labor, right? So I remember my husband driving to the hospital like a crazy person, because at this point I'm screaming, I'm crying, I don't even know what's happening. But at some point I do recall flinging my cell phone in the car. I went in, delivered, stayed there for 2 days, never saw my cell phone that entire time. When I got back in the car to go home, I retrieved my cell phone. You don't want to be in that situation during COVID. You want to make sure that you have a cell phone that works and that you bring that charger with you. Okay, so will entry into the hospital be different? Call your doctor and midwife. Your provider should always know when you are going to the hospital. So if you have an obstetric complaint or concern, you don't ever want to just drive to the hospital. What a lot of people don't know is that your provider is not always, and most of the time, they are not sitting and waiting at the hospital for you to come in. When you think about it, they have to see the patients in the office. That's how they saw you for each one of your visits. Sometimes they could be at another facility taking care of a patient. Sometimes they might be doing surgery, or they could simply be at home waiting for your call. So if you have a concern that you believe warrants being evaluated, you want to call them first. They can also help prevent unnecessary visits, especially in a time like this. So let's say, for instance, you think you broke your water, which is not as easy to tell as some people would lead you to believe, especially in the movies. They may be able to talk to you over the phone and walk you through determining whether or not your water broke and determining whether you actually need to go to the hospital. So it is so important to call your provider before you go to a hospital. You may be screened over the phone. So COVID screening questions may be asked to ensure your safety and the safety of others. And I know that this is happening at a time where either you're having a lot of pain, or you're scared, or you're not sure what to do. You do not want to take this as a time to be confrontational, and we don't want you to feel like we don't care about what's going on. Our number one concern is your care and your safety. And so you do not want to be compromised in terms of your exposure or your provider's exposure to COVID-19. Your temperature may be taken. So that's one of the most widespread basic screening tests for COVID. And so as you enter, someone may take your temperature, and there's multiple ways. Some entrances may even have it automatically and you don't even realize it. And know that if you are the patient and you have a fever, you will not be turned away, okay? But if your support person has a fever, they may turn your support person away. Why is that? So I'm going to take just a moment to talk about COVID and the spread. At one point in the state of New York and New Jersey, for every one person who had COVID, they could spread it to 5 people. There was a time period in the past few months where one person on average was spreading it to 5 people. And we'll talk about the different type of ways to spread it and symptoms in just a minute. So just imagine if your support person is sick and they don't know, and all they have is a temperature, and they enter into the hospital and expose 5 other people who then get COVID, who then take it home to their family, spread it to coworkers, etc. This is how COVID is getting to where it is. This is exactly what the virus wants, right? And so we have to put these restrictions. Now, that doesn't mean that you need to be in the hospital by yourself. They may ask you to come in by yourself, but another support person should be allowed to take their place, given that they too do not have symptoms. How will my hospital stay be different? So first off, everyone's gonna look different. Everyone is going to be wearing some form of PPE, personal protective equipment. You're gonna be wearing some form of PPE. You come in with a mask, that's technically PPE, right? So PPE comes in the form of an N95, and you may have heard this on television, in the news. An N95 is a special type of mask, or respirator, we actually call it as well, that fits over your nose, face, and chin, and it creates a perfect seal. Okay, so if you're gonna wear an N95, you actually have to be fitted for it. There's a fit test that you go through that takes a few minutes to ensure that the N95 that you are gonna wear is gonna have a perfect seal. And this is to prevent the spread of COVID from someone who might have it, and so that I do not get it, right? I don't breathe in those particles and molecules of the virus. On top of that N95, there might be a surgical mask. Okay, that's what we would consider a lower level mask. So you can't just wear a surgical mask to protect yourself against COVID, but because our N95s are so scarce, we are wearing surgical masks to preserve them so that we can use that N95 for a longer period of time. In addition, I might have on a face shield so that I get full coverage over my eyes, my nose, my ears, on top of the masks that I'm wearing. You may also see a health provider in gowns. Some of them might be disposable, some of them might be paper, as well as gloves, okay? You might be in a negative pressure room. Typically, facilities and hospitals do not have a lot of negative pressure rooms. Most units might have 1 or 2, okay? Most of the time, most of the years, most of the century, a negative pressure room was for a very rare patient who had tuberculosis, which is very rare in the United States. And so negative pressure rooms were not in high demand, nor did they design them. And so during COVID, what had to happen was that a lot of facilities had to recreate a negative pressure room. And by doing that, engineering has to come in and create essentially like a vacuum that suctions the air out of the room through a window. That is extremely noisy. So the quiet ambiance of the labor and delivery room may no longer exist. You might find yourself speaking very loudly. You're not going to hear the nurse or the doctor as well. It is a totally different setting. And what we have to keep in mind is this is created for your safety. You might experience what's called bundled care. And so the concept here is that your nurse or doctor may not be able to come in every 15 minutes to address each concern. Instead, they're going to come in and they're going to go over several things at once. They're going to go over when to feed the baby, how to hold the baby, how to change the diaper, and how to bathe the baby, right? Then maybe a few hours later, they're coming in to go over 5 other things. The concept here, and actually let me switch over to the visitor restrictions. Your visitor may be discouraged from leaving the room at all, okay? Which oftentimes they're providing food for the visitor, but they might discourage them from leaving because every entry into your room is an opportunity to increase the spread of COVID, okay? And that is exactly what we do not want to do. So here is a typical picture. We often wear hair coverings, some type of protective eyewear, a mask. This is not an N95, but most of the time when I'm at work, I'm actually wearing 2 masks. And then you can see the gown on it as well. And we just want to remind you that behind every mask is a provider who cares. So when will I be discharged? Oftentimes a patient will roll up to the desk coming straight from home onto labor and delivery. And the first thing I hear is, when can I go home? And I have to be honest with you, I'm happy to hear that. That means you don't want to be here because you don't want to leave with anything you didn't come with. And that is how I want everyone to think. The hospital is not a hotel. We are here to care for you, but you are much safer at home when you are doing well. So hospital stays have been safely decreased by about 1 day. So let's say on Monday you delivered your baby vaginally. A year ago, you would have stayed on Tuesday and you would have went home on Wednesday. Now during COVID, you may be discharged on Tuesday so long as you're okay. If you had your baby via a cesarean delivery on Monday, you would have stayed Tuesday, you would have stayed Wednesday, and you would go home on Thursday. Now during COVID, so long as you're okay, discharges are happening on Wednesday. You should not be discharged early if you have medical problems that have not been resolved. So if you have a major complication that has not been resolved, has not been addressed, you are not feeling okay, you should not be discharged early. That early discharge is only for a patient who is doing well and is willing to go home. So what questions should I ask? So we're gonna go over some things that you should know before you leave the hospital. So this is specifically for mom. When is my next follow-up appointment? You wanna know when you're coming back. If you had a surgical procedure, that might be 1 to 2 weeks, and coming back meaning to your provider, not the hospital necessarily. If you had a vaginal delivery, that might be from 4 to 6 weeks. If you had elevated blood pressures, that could be just a few days. How do I schedule that appointment? So you want to be clear on who you're calling to make that appointment. Are you calling the doctor that you saw? Is someone covering for that doctor? What is the number and how will I reach them? What diagnoses and complications did I have? So let's say you came in and you were planning on having a vaginal delivery, but you ended up having a cesarean. All of that can happen at a time where you may not realize what's going on. Before you leave, make sure that your nurse who's discharging you can go over all of these things. And if they don't know, then you need to speak to the doctor. Sometimes we have to be reiterated and told the story again. This is why you ended up having a C-section. You know, you want to make sure you know. Maybe you had a fever and you were on antibiotics. You want to know what that diagnosis was. And the most important thing I can stress about labor and delivery for a mom is your blood pressure. How was your blood pressure? When they come in to take your blood pressure, ask them what it was. Look at it, look and see what it was. Be aware of it. Have your support person write it down. You want to know, was my blood pressure normal? Was it slightly elevated or was it very high? Because that is something that can reoccur or creep up on you once you go home, okay? Your blood pressure is the most important thing you want to self-monitor when you have a baby. And if it was perfectly fine, you may not be, most of the time we do not give instructions to patients to check their blood pressure at home. It's usually only when you had a problem in the hospital that we're gonna recommend that you check it at home. Is there a virtual support group for new moms? And so you want to ask your provider about that way early on in the pregnancy if you can. You can ask the hospital. It might be supplied by either the hospital or your doctor. Is there lactation assistance virtually? That's super important, especially if you're going home a day earlier where you could have had more practice with the baby and with someone assisting you. And who do I call if I have a severe headache, chest pain, or shortness of breath? Most of that time, that's going to be your primary provider. Every now and then, answering services don't work. So if you are not feeling well and you have one of these red flag symptoms here at the bottom, do not keep waiting for a call back if an hour goes by, if 2 hours go by. You need to call the hospital and you need to go in, okay? So questions you should ask and things you should know before you leave the hospital regarding the baby. You want to know how to change my baby's diaper. For most people, that's very simple. Usually everyone's had a child around at some point, but think this is going to be very different. When you are in the hospital delivering, you do not have all of those family members or support people that would have been there before. When you go home, you may not have them with you either to teach you those little things. So I'll give you an example. So when we were little, when we were younger, everybody who got a diaper change you threw baby powder on them, right?
Yeah.
Yeah. That is no longer, right?
No.
That is a no-no. That is such a big no-no. Johnson & Johnson has paid out millions of dollars. Women have been linked to getting ovarian cancer. That you do not need to buy powder ever again in your entire life. There is no reason to have powder at home, okay? It smells good, great, doesn't matter. It is not, we do not recommend using powder on your baby diaper. Instead, what we might recommend is petroleum jelly, Vaseline, something with almost no ingredients, no smell, no nothing. You want to just have a protective barrier every time you change that diaper. And every time you change the diaper. If you don't and it's dry and it rubs you, your baby's at increased risk for diaper rash, okay? So little things like that. How many wet diapers should I have, right? You need to know when it's not okay to continue to monitor. You should not be going more than 24 hours without at least one wet diaper. And even that is borderline. And I don't want to get into a different field, right? These questions are specifically geared towards the baby. So you want to consult your pediatrician. How long is too long to wait for my baby to eat? Every now and then a new mom doesn't realize that babies sleep a lot. And if you don't wake them up, they will continue to sleep. So make sure you know that I have to wake my baby up by this amount of hours to make sure that my baby eats, because they will lose weight and go down a bad path that you don't want to be in. How to care for a circumcision, that's super important. So if you have a baby boy and that baby gets circumcised, this is something that I found might get lost in the teaching because of the early discharge. I've spent time with patients on FaceTime showing them, and my own family member of mine had COVID-19 and went into the hospital and had a C-section, had a boy. And so we did a lot of FaceTiming to make sure that she knew what to do with herself and the baby as well. And so complications of a circumcision can arise if you do not care for it properly. So you want to make sure that you know what to do. You want someone to show you, want someone to walk you through it, and use all the right things that you have to do. And it's very simple, but if you don't know, if you've never had a baby boy that's been circumcised, then you won't know. You want to know when is your baby's first pediatric appointment. That's usually very soon after you go home. This is not, we're not talking a week or 2 weeks later. We're talking 2-3 days later that you are usually going to be evaluated by the pediatrician. And who do I call if I have a question? So you want to know who you're going to call, right? Mom is very different from the baby. The obstetrician can't help you with the baby. So you need to make sure you have both of those numbers on hand. Okay, so what if I have COVID-19? Okay, let's talk about the signs and the symptoms. We've all heard these on social media and television. Fever, cough, shortness of breath. Those are some of the most common symptoms, right? Vomiting and diarrhea. That one actually got added to the list later because we didn't realize that it was associated with COVID-19. I know someone who only had diarrhea, never had a fever, never had a cough, never had shortness of breath. Diarrhea was their only symptom, okay? Loss of taste and smell. I know someone who had, that was the first thing that happened to them. Forget the cough, forget everything else. It was that loss of taste and smell. Breakfast didn't taste good anymore. You didn't really have a desire to eat. Muscle ache or fatigue, that's a hard one when you're pregnant, right? When you're pregnant, who's not tired? But you know the difference between having real muscle aches. You want to pay attention to that. And the point here is this. So if you're pregnant, that can bring anxiety on itself, right? You're caring for this human inside of you. You want everything to go right. And you're just filled with these thoughts of how can I do my best? Now to be in a pandemic, know that you are in a very different time and you could never prepare for this. But the one thing that I can tell you is that you were built for this. You were built for this before COVID. You'll be built for it during and after. And you are the safest person to care for that baby. And if you are reading, if you're watching and participating in this presentation, this could be you. You could have one of these symptoms. The fact that you can hear me and watch this means that you are okay, right? We want to take away the stigma from COVID-19. I noticed early on, patients would be almost as if they treated COVID-19 like they got it because they did something wrong, or they got it because they were poor, or they got it because they were too sexually active. COVID has no preference for race, activity. It doesn't care who you are. Anyone can have it around you. It is not what you did. It is just simply being exposed. And so majority of women, if they get exposed to COVID-19 and if they become positive, majority of them who are pregnant will be okay. Only a small percentage will require more intensive treatment, such as admission to the hospital, such as going to the ICU. And even less of that small percentage will require intubation with a breathing tube down their throat. And so majority of women, thankfully, that we have seen, remember, we're still getting a hold on this, you will be okay. You could have, we've had patients with COVID-19 in the middle of their pregnancy, and by the time they go to deliver, it is irrelevant, right? Because they have recovered, they are doing better, they have been retested, and they are negative. So it is not the end of the world if you get COVID-19. We want you to do everything you can to prevent it, maintain your immune system, and if you get it, we will treat you and you will get through it. So first things first, if you have any of those symptoms, you want to call, okay? If you have those symptoms and you cannot breathe, you need to call 911. This is not a time to think about it. If you are having difficulty breathing, which is one of the most easiest signs to kind of discern that you are unstable, you need to dial 911. You need to tell them what is going on. Tell them that you are pregnant. Tell them that you are concerned that you might have COVID-19. Warn your providers of who's coming in to that, of what they might be coming into, okay? If you are stable, let's say you just have diarrhea or you have a fever, and I'm saying that you're tolerating all of this, but if you are stable, then you want to call your provider first. You want to explain all your symptoms. You want to tell them about your pregnancy. When are you due? How many weeks or how many months you are? What complications do you have? This is not the time to hold on to information. Share everything with them that you can so you can get the best care. So there was one symptom that I didn't mention on that slide that you could have if you're actually positive for COVID-19. And that's absolutely nothing. So this slide is just to show you this concept of the asymptomatic carrier, which I'm going to get to in just a second. You can feel totally fine. You can have no cough, no fever, no complication, and you could have COVID-19. And that number is a lot smaller than we anticipated. Like in March or April, we thought it was going to be close to 5 to 10% of people in the epicenter area. We're actually finding that it's closer to 3 to 2%, which is good, right? Because that means that it's kind of scary knowing that you can be around someone or live with someone who seems totally fine, give it to you, and you might also be totally fine, but you could pass it on to someone else who may not be fine, an elderly person, a small child, someone who could actually end up in the hospital or pass away from it. So the asymptomatic carrier is a conundrum. We don't know what to do with it. And that's why the safest way you can behave is to treat everyone as if they are an asymptomatic carrier. If you treat everyone like they could potentially have COVID, you will think twice about the groups that you enter, the places that you go, walking around without a mask, and etc. So here are just a few questions that I've gotten from patients that I thought were really good questions. Just I wanted to share with you in my answer. So I had a patient ask once, will I be entering through the doors of a COVID patient? And I could totally understand the concern for that. This patient, or you might be thinking, if I walk through an entrance where a COVID patient walked through, am I gonna get COVID? And the answer to that is every time you walk out your house or you let someone else walk in, you could be exposing yourself to COVID. And if your facility has a special entrance for COVID, I can guarantee you that that entrance is being cleaned down to the utmost every single time someone comes through it. And so the concern for sanitation and exposure through the known COVID entrance is actually, I would actually say it's safer. Because if we screen you and we don't think that you have COVID and you're coming through, remember that slide about the asymptomatic carrier, right? And so the important part is, am I well? Let me get to where I need to go so that I can be cared for, okay? Will I be in a room that a COVID patient was in? And my answer to that is most likely. You know, depending on where you live, if the peak has already come for COVID there, every room had a patient with COVID in it, okay? And if you live in a place where there are almost no cases, then you probably won't be in a room where a patient had COVID. But I can tell you from experience, when a patient leaves a room who has known COVID, that room is cleaned for about 2 to 3 hours versus a room where prior to COVID turned over in 20 minutes because it is regulated. There is an ultrasonic type clean. There is nothing actually in the room prior to going in there because anything that's in the room that cannot be scrubbed down has to go in the garbage. So will you be in a room that a COVID patient was in? It's very possible. Trust me, it is cleaned to the utmost, okay? Because what we don't want as a facility or a physician is to have patients that come in that we can trace back, eventually got exposed to COVID after they had their encounter with us, okay? Another good question. I've been home for 3 months. How could I have gotten COVID? This is like distressed people. I mean, bawling in tears where they just could not believe that their test was positive, whether we were suspicious based on symptoms and they downplayed it, or they came in to have testing before a procedure and it just happened to be positive with no symptoms. Again, remove the stigma. It's not something you did. COVID is looking to maintain itself on a host. It is so smart, right? That it doesn't just need you or I, a living being. It will live on inanimate objects for several hours. You guys have seen the pictures, you've seen the. So you could lock yourself in a house, but if you have someone else who lives there, that person has a possibility of giving you COVID. You could live all by yourself, but you got to eat and check your mail, right? The package that it came in could have particles of the virus. And this is not to scare you. This is to tell you that it can happen to anyone. Do not ostracize yourself or feel a certain kind of way if you end up getting COVID or had COVID. What's important is your health and that you are cared for. So actually, before I go to the next slide, this is where I wanted to turn it over to Ellen and see if there were any questions from the audience.
All right. So what you can do is present your questions in the Zoom group chat box, or if you want to unmute yourself, if you prefer, you can speak your question. So I'm going to go into the chat box here and I think someone had a question. Well, nope. I think you asked earlier where
people were logging in from.
Where everybody's from in Boston, Maryland. Oh, here's a question. There seems to be discrepancies about whether or not pregnant women are concerned high risk for COVID. So I guess she wants to know, we know that children and pregnant women, I think I've read, not sure if they're higher risk than other, but I guess you could speak about who, if they are.
Yes, so when COVID first hit, at least our area, the response was that they are not at higher risk. A recent statement went out. You can find it on the CDC. You can find it on FACOG, where I'm going to show you in the next few slides, that we are at slightly higher risk for developing COVID. It's still a small percentage, and of that percentage, only a small amount will require intensive type treatment. So majority of pregnant patients that I have come encountered with who get COVID go home and are fine. That is an amazing thing. And to speak to the babies, transmission from a COVID positive mom to a baby is extremely low.
Wow.
I can tell you in the state of New Jersey, I only know of one case. And we have had plenty of COVID positive moms. And so that I am so grateful for. I just like to believe God is looking out for the babies, because we are taking care of COVID moms and these babies are coming out kicking and screaming and totally fine.
Wow, that's amazing.
Yeah.
So another question, can you talk about hospital policies for women who test positive for COVID? I've been hearing about baby and mom separation. Can this be true? How can you advocate for your rights as a birthing mother?
So I can tell you that the National Governing Organization for Pediatrics recommends that if a mom has known COVID, that this mom be separated from their baby during their admission, okay? This is a very difficult topic. It is heartbreaking to say, it is heartbreaking to hear. As obstetricians, we did not understand it at all. Like, it blew our minds.
Can you say the organization that recommended that?
It's the
You know,
the abbreviation, it's the American Academy of Pediatrics, so the AAP.
okay, yeah, really?
And even you'll see there'll be a link to a link on some of the resource that I give you as well. And so as a mom, you can always advocate, right? You cannot allow someone to take your baby from you. But I would encourage you to think a little bit deeper. While it may be the most painstaking, I can't even imagine, right? I have a 3-year-old. I cannot even imagine having a baby and someone telling me that it has to go in a nursery and you can't be with this baby for the time that you're here. I can't even wrap my mind around that, okay? The only thing that would be more hurtful and painful would be if you told me that my baby contracted COVID from me and is not doing well or passed away. And so that's how I have to flip it in my mind. I can't speak to what I would do, right? Because I'm not in that position. Again, just thinking about that statement, like, it wasn't just patients thinking that's crazy, okay? It was everyone. And so that we have to respect what they know and what they're putting out there, and you have to make the decision for yourself, but you also have to understand the potential consequences. So I can tell you that a family member of mine, she tested positive for COVID-19. Her husband tested positive. She went in for a scheduled C-section, and he was allowed to be in the surgery, which is not really typical, right? Because if he has COVID-19 and he infects the whole OR, that's a whole nother thing. So I was even surprised that he was allowed to be in the surgery. He stayed with her for the delivery, and then he went home. So she was in the hospital by herself, and her baby was separated from her. And they encouraged that when she went home, she had to wear a mask. She can't kiss on the baby. He can't kiss on the baby, and that, and not to breastfeed, right? So these were not to breastfeed. She could pump or give bottle feeding. And so she struggled with that, right? Like, that is a big deal. And she did the best that she could. And I'm so happy to say that she's well, her husband's well, and her baby's well. You know, what she went through is for the books, right? Like, any woman who delivers during time, you might as well just call yourself the strongest person on earth. But the reality is, whatever you're told and whatever you choose to do, you have to be okay with it and the sequential path that will occur.
All right. Another question came in. Okay. How can you advocate for your mother? Can COVID testing be declined when admitted? Can the mother decline it, or can anybody decline it?
You can decline anything. what you just have to understand is what you're saying when you decline it. So there are certain reasons, and I encourage providers, whenever a patient declines something, what we really need to figure out is their reasoning behind it, right? And not everyone is intuitive enough to do that. There could be a fear of knowing that you're positive, or it could be that you got tested yesterday, right? Like there's different reasons why you would decline. However, if you decline the test, my assumption, depending on where you are, is that they will then treat you as if you have COVID-19, because they won't know, and the goal is to decrease the spread. And so that could include simply wearing a gown and the N95 and the face shield, or that could include separating your baby. It all depends on the policy, right? And so then at the end of the day, you have to ask yourself, my reasoning behind declining, is it worth the consequences of what I will be subjected to? Because now we have to function on a healthcare for all type of level, right? We're not in our own little box. So the greater public safety is involved in all of our decisions.
Question, is ACOG encouraging home deliveries for those who can have home deliveries? Are they having midwives come to home deliveries? Like, what's that transition? I know that we all are going through a lot of virtual visits, and I know that labor and delivery, something that you need to have a provider around. How are home deliveries and providers doing home deliveries, or midwives, or even physicians? Can you speak about that?
So ACOG has not put a statement about encouraging home deliveries. They have always spoken about home deliveries and trying to make them as safe as possible. So I don't think that they've added the COVID layer onto it, but I can tell you that birth center numbers have gone up, right? Because if you're a patient,
the numbers have gone up, you mean?
Meaning instead of going into a hospital,
more people are going into the birth center.
Absolutely, because if you know that when you're there, there's only going to be you delivering, right? Because most often that's how it is. You're not going to have 10 people laboring in a birth center, and you feel safe and you're COVID negative, or you have no symptoms, then patients have definitely been opting for birth centers. And so there are midwifery groups that do home deliveries. And so that is definitely an option. But what you have to do is find out their procedures for COVID now based on where you live. Because I know groups that were increasing their numbers and going into homes and delivering back in March is not the same as now because of their exposure. They've been exposed, they have become positive because of it. And that's the thing, right? Like, we want to look at each other and say, well, you don't look dirty, so you don't have COVID, and you look nice, so you don't. That's not it. COVID doesn't care. COVID doesn't care.
All right. I don't think we have any more questions coming in.
Okay, so I'll go to the next, just the last two slides. So this is a resource. Sue Ellen mentioned ACOG. So ACOG is the American Congress of Obstetrics and Gynecology. Feel free to, you could take a picture or a snapshot of this. If you were to just put in the first line and a half, you'd probably find it. You don't need all of the extra. ACOG has tons of resources for patients. You don't have to log in or pay or be a doctor or a midwife. If you go to their website, you can search for patient information, and they can go through resources there, and then they will give you other links to the CDC, to the American Academy of Pediatrics and things like that. So that's one really good resource. When you go straight to the CDC, it's hard to weed out because you're trying to get to the pregnant patient, right? The CDC is for everyone, but ACOG is specifically for that obstetric patient. And if you have any further questions, anything you want to ask, you're looking for a professional to help you, whether it's simply for obstetrics, or, COVID is impacting every single person in a very different way. And the stress level is intense on everyone. There are resources out there for you. There are therapists and counselors free of charge, and I can help point you in the direction. So if you have any questions, you're looking for information, feel free to email me as well. I know Sue Ellen put her information at the beginning
Yeah.
the presentation. And, at this time, as long as there's no other questions, we just want to give a special thank you to our audience. And Sue Ellen, I'll let you take it from here.
Yeah, thank you so much, Dr. Martinez. It's very helpful. And I thank you so much, everyone, for participating today. So this webinar is recorded, and check back on our YouTube channel and you'll be able to review it again or share with your friends and family. If you also have questions, general questions, and you would like to follow up with me, you can also send me an email at complete@360girlsandwomen.com. And feel free to ask any general tips. And if you want to sit down for a one-on-one, you can also schedule a free discovery call. You don't need any payment, any insurance. You just want to figure out if we can work together, or you want to address some concerns, and I can let you know if we could work on them as a team. And that's it for today. So thank you again, Dr. Martinez, and thank you all so much for joining us today. Have a wonderful rest of your day.
Thank you so much for having me.
All right.